Okay, I guess by way of preamble or backup, I realised on the weekend this is my 47th year as a physiotherapist. I did allocation when I first graduated at Royal North Shore Hospital, and in those days it was a merit-based system, and it was a prerequisite to being registered, so you're required to do a professional year. I've always worked in the public system. I have had some experience in private practice and private hospitals, but I come back to the public system. One of the reasons there are many reasons. Primarily, I have always chosen large teaching hospitals, and I would push very strongly for people to either work in a public teaching hospital or, if not, a metropolitan public hospital. In a public hospital, you get a wide variety of patient types, diagnostic groups, skill sets. In teaching hospitals, you get medical, nursing, allied health students and new graduates, so that the more experienced staff are focused towards dealing or managing with new graduates or students. They're used to being asked questions, they're used to answering questions and explaining what they're doing. If one go, and I think this comes into a further down the line, but usually in a public hospital, preferably a teaching hospital, but it doesn't have to be, is that there is a lot of support, so that even within your own profession, if you can't get support, there are other disciplines of experienced people who can give you support by way of telling you where simple things are, look in this cupboard, that cupboard, through to managing patients. There is a structured support system and hierarchy usually within a public hospital, and again I find that you get everything that happens medically may go to a private hospital, but invariably if it's beyond the private hospital's ability, it comes back to a public hospital. So in other words, the public hospital deals with all manner of medical surgical problems. Likewise, if something can't be sorted on this floor, suppose one is admitted to a women's health ward and the facilities aren't available on that ward, there is another part of the hospital where resources can be pulled in to manage that problem. So to me, the skill set is within the skill set, the expertise and knowledge is fundamentally within the public system. Okay. And you can move around very easily across the continuum, as a physiotherapist, across the continuum of a public hospital as well. There's much more, from my experience, more opportunity to rotate within clinical areas or to other clinical areas. If you feel that you're not interested in one area, there are other opportunities. I've also found the public system has always supported ongoing learning. Funds have tightened up in the last few years, but certainly in terms of leave to go to conferences, big emphasis on research now, and there's lots of opportunities and grants available within the public system to further your education. Grants, scholarships, and if the money isn't available, then usually the time off is available. So you're paid to go to a conference as a normal working day. So I think there's unlimited opportunities within the public system. They're just a few. Most big public hospitals are used to working with young people who are enthusiastic and keen to try new things, so that if you have a desire for research, if you want to put in place evidence, if you want to do a quality improvement to improve the patient outcome, I found from my experience the support is there. They're respectful of allied health, they're certainly respectful of physiotherapy, so that you become part of a big team if you stay in the public system long enough. And also there's flexibility to work within area health services. You can request to move to other hospitals in an area health service, or you go to other area health services. And fundamentally there is a basic system as to how public hospitals work, so that if you spend 5 years at Westmead and then you go to Prince Alfred, different hospital, but the basic structure is there for you to build on. It's not such a shock as it can be from going from a private system to a public system. My whole career has been in public health, and there's not a thing I haven't been able to do and achieve staying in the public health system. Okay, so I've spoken with the fellow who's acting deputy at the moment, who's also a senior orthopaedic physio. Westmead takes 10 first-year graduates a year and has done for a long time. I've been here 20 years, we've always had first years. I guess the first thing, the things that impress us, the things that we're looking at is enthusiasm for physiotherapy, a passion for the profession. Sometimes we've had people in the past who did well in their HSC, they got into physio because they got the good results and that was the profession that was there, or a family member wanted them to do it, or they didn't get into medicine. So they graduate from physiotherapy and they find it's not their passion. And it's very evident when they come onto the clinical environment. So we're looking for people who have a passion or who are proud to be physiotherapists and who want to grow within the profession. We're looking for people who, what I call, are self-starters or self-directed, initiative. So they're people who come here. It's important that the first years know their limitations. Sometimes we have people who are very self-confident and may or may not have the infrastructure or the skills and knowledge to support that confidence, and they're not happy to get feedback along those lines. So we would like to have people who know their limitations, they know when to ask questions, they know if they're not sure that they can do something safely, either for their own safety, their colleagues or the patients, that they have the, humility is not the word, but they have the ability to come to a senior therapist and say, I'm not sure what to do, or is this correct? Because we would rather have someone say to us, I don't know, or I'm not sure how to do this, than have someone assume they know what they're doing and it all goes pear-shaped. That's a much harder problem to fix on many fronts. So people who know the limitations, enthusiasm for the profession and physiotherapists who want to grow as physiotherapists, who are prepared to take feedback, and which comes with a willingness to learn. In this environment, in a big public hospital, we need people who are flexible. I do the weekend rosters as the other rosters, and it is very disconcerting when I find people who dictate when they can and cannot work. Part of working as part of a team is flexibility. I take into account people's preferences for when they can work or not work, or what clinical areas they want to work in. However, there are 80 staff here who all have preferences for what they want to do. So we respect flexibility. Yes, I'm happy to do this today, and therefore tomorrow I can do something else. Teamwork is key. Key work both professionally up in the clinical area, but also within the department in terms of working together professionally with people for the 8 hours that you're here to create a harmonious environment. Good communication, knowing your limitations, ability to ask questions, I've already covered that. So basically it is a keenness and enthusiasm for physiotherapists as a new graduate, and a willingness to learn and to grow, and respect your colleagues, and respect the not just professional physiotherapy colleagues, but generally all health professionals in a hospital. I would absolutely encourage all students to apply for allocation. I think it concerns me, and I had dinner with 2 older physiotherapists last night and we were discussing this. I believe allocation years should be mandatory. I think, as with line with other professions, it gives us credibility. Medicine, nursing, engineering, accountancy all have a professional year. By making it a mandatory professional year, it allows you to work under supervision for 12 months in treating the public. You can't know it all in 4 years of a science-based degree, which I find is trending more towards theoretical knowledge than practical skills. So that I think that first year out allows you to put into place your practical skills based on your theory, put in place your clinical reasoning, but in a safe, protected environment, because there are senior clinicians supporting you. Certainly the way most of the teaching hospitals structure allocation is to give you a general well-rounded experience, so that at the end of 12 months you have probably done some orthopedics, some neuro, a lot of chest or cardiopulmonary physio, MSK physiotherapy, so you've dabbled in each. That allows you to develop practical skills. It gives you confidence in yourself, so that where you go in your second year, wherever you end up, you can think, yes, I can do this because I've had this experience, I've seen this problem before or something similar. But you're safe and protected, and there is somewhere to go for help. If you don't do allocation, depending where you end up, you're very much having to figure it out for yourself, and that's hard work. It's also stressful. I personally think allocation should be mandatory. And it's a solid, I can remember back to things I learned as a first year, which was a long time ago, that still stands me in good stead today. I was with a physiotherapist last night who graduated years before me, and a colleague of mine, and we all three agreed that our basic skills training of that first year out, we could probably generally approach a lot of patients and treat them to this day, even though we aren't trained in the modern system. That core knowledge of a first year has stood us in good stead. And I think, and particularly for most places, if you have to do an evening shift or a weekend shift, you learn to think for yourself, but again, it's under the umbrella of support. So your question was, what advice looking for allocation? I would encourage you to apply for allocation, definitely. If you're not successful, then I'd be seeking to work in an environment where there is support for first years, where there's proper teaching time set aside, it's not on the run, where you're allowed to grow under supervision for 12 months, and the opportunity to practice on the public with supervision. Okay, I think certainly private hospitals, I would certainly be looking to go to a private hospital. As I said, even if you don't get into a teaching public hospital, go to another district metro hospital. Look to go to the country for 12 months. All right, you live in the city, or your friends are in the city, your world's in the city. It doesn't hurt for 12 months to go to a regional facility. Wollongong, Newcastle, Armidale, Tamworth, Wagga, I would go to any public hospital, be it in the country. You might find, if you're a city slicker, that 12 months in the country people are very nice generally. The patients are nice, the environment's supportive. You might find that you actually, after 12 months in a regional or country facility, I'd rather stay here than work in the city, because it's a different environment and you make your own fun. Again, if you go to a country hospital, the support is behind you. So don't just look at the Sydney city hospitals if you're in New South Wales. Go country. They're desperate for allied health people out there. Often you get another young environment of allied health and medical nursing staff in a country environment. You create a new life. It's only 12 months. You can come back to the city at the end of that. The other thing about going to the country is that you often may be a sole practitioner or in a very small team. So you learn to consolidate your thinking, you learn to think about what you're doing and to be independent, become an independent thinker. Sometimes if you stay in a teaching hospital, you can be a bit spoon-fed because all the resources are here. So I'd go country for 12 months, point one. Look at the private hospital system. There's a lot of big private hospitals in Sydney now, usually attached to a public hospital, where they take first years. Go to the private hospital. If it's attached to a big teaching hospital, say to the manager of the department, is there an opportunity to rotate next door to Westmead or next door to North Shore or Prince Alfred or wherever you happen to be? So I'd look at private hospitals. If you're looking at a private practice, again, the trouble with a private practice is it's mainly musculoskeletal oriented, so that you consolidate those skills and you miss out in that first year of consolidating your cardiopulmonary and acute skills. However, I do realise that a job is a job. If you go into a private practice, at the end of 12 months, you might decide, well, this is for me, I'm happy to stay here, or No, I've done private practice, which I had done. I prefer to be in the public system. So I think the important thing is get a job. If you miss out on allocation, it's not the end of the world. It's a bit like the HSC. There are other opportunities. Go country, go regional, go private hospital, go private practice. I believe last year most people who applied for allocation and missed out had jobs within 4 months. So the jobs are there. You might have to go interstate even. Again, as a young person, I'd say go for it. You mature both professionally and personally if you're forced out of your own environment, I think. It can't do you any harm. Yes. The world will open up. You're all young. You've got the rest of your life. How to access other hospitals. One thing I would encourage students is when you're on your practicum, if you like where you're doing your practicum, be it Children's Hospital, wherever it is, while you're here, if you think you might like to come back to, say, this facility next year, take 5 minutes in your 5 weeks to introduce yourself to the head of department and say you've enjoyed working at this hospital, you've enjoyed the experience. Ask them what opportunities are available as well. It doesn't hurt. It's a form of networking. It doesn't hurt to express your interest in the organisation. You never know down the track when that person will remember you. So 5 minutes on your way up and down the corridor doesn't hurt. The other thing we haven't covered is allocation interviews, and we may not have the time now, but I certainly think it's worth the first years, if you're going for allocation, to think about we interview everyone now, to think about interview skills. We have had some very good interviews with first year grads, and we've had some terrible interviews with first year grads. The terrible ones are people who haven't got themselves organised. They haven't thought about the hospital they've applied to. They haven't taken the time to think about what rotations might be available to a first year here, what they can expect from being a first year, but also what they can offer. I should have mentioned this before, but both the manager and I here have been asked at interview, what can you offer me if I choose to come to Westmead? My question is, what can you offer Westmead? It's a two-way street. It's not all about us feeding a first year. It's about a first year becoming part of this department. So what can you offer us as well as what can we offer you? And I think people need to think about that when they come to interview. There you go.
Thank you.
You're welcome.